Alright, in this video we will be discussing about diarrhea, and to be more specific we will be discussing about acute diarrhea per se. Right. First of all, definition of diarrhea. In general, diarrhea is defined as passage of abnormally liquid or unformed stools at an increased frequency. For adults, stool weight of more than 200 grams per day can generally be considered diarrheal, and that is on normal individual diet or normal diet right? On normal diet, if stool weight is more than 200 grams per day, it is a definition of diarrhea. Diarrhea may be further defined as acute, persistent, or chronic. If less than 2 weeks, it is acute. If 2 to 4 weeks, it is persistent. If more than 4 weeks, it is chronic in duration. Right. So this video we will be restricting our discussion to acute diarrhea only. Right. So coming up with the causes of diarrhea. The causes of acute diarrhea are infectious and non-infectious. In this slide, we will be discussing about the infectious causes of acute diarrhea. The different population groups are prone to different kind of infections. For example, travelers, they are prone to travelers diarrhea, and travelers diarrhea is most commonly caused by enterotoxigenic or enteroaggregative E. coli. E. coli is the cause. Which one? Enterotoxigenic and enteroaggregative. Other are Campylobacter, Shigella, Aeromonas, Norovirus, Coronavirus, and Salmonella also. So this will cause travelers diarrhea. It is most common in Asian countries. The travelers from other countries, they come to visit India and they get infected with this travelers diarrhea. Asia. First is the travelers diarrhea. Second is the consumers of certain foods, means food poisoning per se. Bacillus cereus is found in fried rice. Staph aureus is found in Staph aureus or Salmonella are found in mayonnaise or creams. Salmonella is also found in eggs. Listeria is found in uncooked or fresh or frozen foods, mushrooms, and also in dairy products. Vibrio species Salmonella or acute hepatitis A is found in seafood, especially frog. So these are the foods which, if someone consumes, may be may get infected with these bacteria, and these bacteria contain preformed toxins. Most of them preformed toxins, and these preformed toxin will cause some GI upset, GI inflammation, and that will lead to signs and symptoms of diarrhea. Third category of the individuals are the immunodeficient persons. In immunodeficient persons, like in AIDS, right, or hemochromatosis, these individuals are more prone to infection with some organisms. For example, AIDS people are prone to infection from Neisseria gonorrhoeae, Treponema pallidum, and chlamydia, because they are the other sexually transmitted infectious causes. They may lead to proctocolitis, and it may present as diarrhea. Hemochromatosis patients can get infected with Vibrio species and Yersinia infections, and they should avoid eating raw fish and exposing open wounds to seawater, because they are more prone. Fourth category are the daycare attendees and their family members, right? The patients who come routinely on into the OPD for some daycare procedures, like for chemotherapy, like for some gynecologic procedures. They may also get infected with some organisms, some particular set of organisms, like Shigella, Giardia, Cryptosporidium, rotavirus, and other agents. Similarly, institutionalized or hospitalized patients, they are very much prone to Clostridium difficile, this CDI, Clostridium difficile infection is very much common nowadays because of in because of very vague use of antibiotics. Clostridium difficile infection is caused by antibiotic use. Clostridium difficile is normally found in human gut, but when we use antibiotics, very vaguely without cultures, or when there is no need of antibiotics or excessive antibiotics, then the normal bacteria will get eradicated and Clostridium difficile will grow more, and this will lead to Clostridium difficile infection, right? And there is no history, sometimes there is no history of antibiotic use also, and it is community acquired, but many a times institutionalized persons, hospitalized patients get infection with CDI, right? So these are the five categories of individuals who are prone to acute diarrhea, and that also infectious causes. Now we will be coming on to the pathophysiology of acute infectious diarrhea, that how these different organisms, how do they cause diarrhea, what is the pathophysiology, and what is the sign and symptoms of different organisms, so that you can get an idea from the clinical history and presentation of a patient that what organism could have been there underlying the cause of this diarrhea. So first category here is the preformed toxins. Preformed toxins are produced by some organisms, like we have just discussed in traveler's diarrhea. Some organisms which have preformed toxin in them are Bacillus cereus, Staph aureus, Clostridium perfringens, Vibrio cholerae, Enterotoxigenic E. coli, and some other causes of E. coli. Right. So these are the organisms which have preformed toxins. What will be sign and symptoms of them? Signs will be, see, very, which is very peculiar sign of preformed toxin diarrhea is vomiting more than diarrhea, because of upper GI and small intestine infection. Vomiting will be more than diarrhea, and there will be no or minimal fever, right? And there will be no no bloody diarrhea. These are the causes of preformed toxin and their signs and symptoms. Similarly, cytotoxin is produced by some organisms. Two most common are the Clostridium difficile and enterohemorrhagic E. coli. They produce cytotoxin, means they will cause cellular necrosis at the level of intestinal mucosa. There will be malabsorption, and there will be fever. There will be malabsorption. There will be diarrhea more than vomiting, and very peculiar feature is there will be fever. That is, I have already told. This is a very peculiar feature, fever, right? And diarrhea, sometimes it can be bloody diarrhea also, because there is cytotoxin, uh, and cytotoxin causing injury. It may cause bleeding, profuse bleeding, bloody diarrhea. Initial stages maybe only watery diarrhea may be present, but as soon as the initial stages get covered, bloody diarrhea will ensue. Third cause is the invasive bacteria. Invasive bacteria like Entamoeba histolytica, Yersinia, Shigella, Enteroinvasive E. coli, they will cause fever. The signs and symptoms are, just similar to those of cytotoxin. They will cause fever, and they will cause bloody diarrhea to start with. This is the pathophysiology and signs and symptoms of some categories of bacterial causes of infectious diarrhea. What are the other causes of acute diarrhea? Means which are non-infectious causes. Non-infectious causes of acute diarrhea are, first is the medications like laxatives, like NSAIDs, like chemotherapy drugs, like SSRIs. They can cause acute diarrhea. Second is the occlusive or non-occlusive ischemic colitis, which occurs in persons aged more than 50 years, right? This is a surgical cause, occlusive or non-occlusive ischemic colitis. Third is the diverticulosis, mainly seen in older age group. Then GVHD, graft versus host disease, will present as diarrhea. Then ingestion of toxins like organophosphate compounds, OPC poisoning, diarrhea, salivation, lacrimation, and vomiting. These are the very common side effects of organophosphate poisoning. Then amanita and other mushrooms. They also contain some cholinergic compounds. Arsenic in itself can cause diarrhea. Preformed toxin in seafoods like ciguatera and scombroid. Scombroid poisoning contains histamine. This is a previously asked question in some entrance exam, NEET PG or something. This is a very important point to remember per se. Scombroid poisoning contains histamine, and histamine can cause diarrhea. Similarly, ciguatera from fish, right? These will contain preformed toxins. These are not infectious causes, but the chemicals or the compounds that they contain, they cause diarrhea by themselves. So these are the other causes of diarrhea. Now, how will you approach a patient with acute diarrhea? See, first of all, acute diarrhea, most of the cases are self-limited. So you do not need to treat mild diarrhea. I mean, we have treat all the cases of diarrhea, but you must not evaluate with very expensive tests the patients of mild diarrhea, because they are mostly self-limited. So you need not evaluate, right? If the diarrhea is severe enough, you go for evaluation. Remember, we are discussing about acute diarrhea only. Evaluate with history, evaluate with drug history, evaluate with CBC and routine investigations, evaluate with the stool culture, etc. You have different modalities. If you find out that the from the history that the patient is having infectious diarrhea, from the history of fever, from typical history of travel, or from history of some intake of some in raw food, these points in history will point to the infectious causes of diarrhea. In infectious diarrhea, you have to evaluate with stool examination and culture, and visualization of ova and cyst directly under the microscope. Then you can do CBC, KFT, LFT, right? These are basically the investigations that you will do in case of infectious diarrhea. Most important is the culture. Colonoscopy is required for patients who have some structural causes like ischemic colitis, like initial stages of inflammatory bowel disease, like diverticulosis, etc. These individuals will require colonoscopy or sigmoidoscopy, or even upper GI endoscopy to rule out some cause of diarrhea. So these are the different modalities and different causes and individuals that you will evaluate to find out the cause of diarrhea. This is a basically algorithm. that if a patient presents to you with acute diarrhea, how will you evaluate that patient? For example, if a patient comes to you with acute diarrhea, you will do history and physical examination, and if it is likely non-infectious cause, what are the non-infectious cause? Drugs, preformed toxin products, toxins like organophosphate compounds, and toxins like some mushrooms, right? Then there may be diverticulitis if the patient is individual, I mean, older individual. There can be ischemic colitis, right? There can be arsenic poisoning. These are the different causes of non-infectious acute diarrhea. But if the patient is having fever, if the patient is having leukocytes in stool, if the patient is having, you know, uh, bloody diarrhea, these symptoms point towards that the patient is having infectious diarrhea. In these cases, you will do if first of all you will do the categorization. You will categorize whether it is mild, whether it is moderate, or whether it is severe. Severe means incapacitated, the patient is not able to go to the work, he is not able to, you know, get up from the bed per se. Moderate means if the activities are altered, he has to take frequent breaks. Mild means unrestricted, the frequency is not much, there is no fever, there is little or minimal vomiting, means the movements and the work is unrestricted. So mild, moderate, severe diarrhea you have to categorize. If the diarrhea is mild, you have to observe, and if it resolves, it is well and better. If it persists, you have to do stool microbiology and further studies. If pathogen is found, to treat the specific uh, pathogen with specific antibiotics. If no pathogen is found, you have to give empirical treatment and further evaluation. This is the mild diarrhea. Similarly, moderate diarrhea, if it is there, this is not stable, excuse me. Okay, if it is moderate diarrhea, and if the fever is more than 38.5, there are bloody stools, fecal WBCs, immunocompromised or elderly host is there, right? So in this case, you will again do stool microbiology, and the further steps are the same as that of mild diarrhea. But if these signs and symptoms are not there, you can give antidiarrheal agents in this group of population. Means moderate individuals will receive antidiarrheal agents, and if it resolves, it is well and better. If it doesn't resolve, it will persist. You will have to do again the stool microbiology and find out the pathogen. If the diarrhea is severe, you have to start with stool microbiology, and if pathogen is found, you have to treat the pathogen. If not found, you have to give empirical treatment and further studies like colonoscopy, squamoscopy, or whatever uh, modalities you have to pursue those in order to, you know, find out the cause and treat the patient. In every case, irrespective of mild, moderate, or severe, you have to look for signs and symptoms of dehydration, and you have to treat uh, this dehydration. You have to replace the fluid, replace the extracellular or intracellular volume. You have to hydrate the patient to the max, right? So this is all about the approach to the patient of acute diarrhea. Now, how will you treat diarrhea? See, for treatment, as we have discussed in the previous slide, if there is mild, there is no need to treatment, you have just observe. If there is moderate, you can give uh, anti-motility drugs and anti-secretory drugs. Motility drugs, anti-secretory, these drugs are, what are these drugs? These drugs are like loperamide and ondansetron to some extent. If there is severe infectious diarrhea. You will do culture and antibiotics. But if you find no pathogen, then you have to give empirical treatment. What is the empirical treatment? It is Ciplox, Metrogel. Metrogel means metronidazole. So these two will form the empirical treatment. Sometimes these two are not effective and you suspect that the patient is from Nepal, the patient has traveled to Nepal. There cryptosporidium is very much common. For cryptosporidium suspicion, or if the patient is not getting improvement with Ciplox and Metrogel, you will have to give nitazoxanide. It is a newer antibiotic. Rifaximin is the drug of choice for traveler's diarrhea. So these are the options that you have for the treatment of acute infectious diarrhea. Or if it is non-infectious, you can observe or you can give anti-motility, anti-secretory drugs. So that is all about acute diarrhea. Let us recap them once again. Definition of diarrhea: infectious causes, 5 individual groups, right? Then the pathophysiology of diarrhea, then other causes of diarrhea, then we have learned the approach to diarrhea, acute diarrhea basically, then we have studied the treatment. So that is all about this video. Thank you so much for your patience listening.